Psychodynamic therapy. Introduction. Psychodynamic therapy is a deep-seated and comprehensive approach to understanding human behavior and treating psychological disorders. It is rooted in the theories and principles of psychoanalysis, developed by Sigmund Freud in the late 19th and early 20th centuries. Over the decades, psychodynamic therapy has evolved and expanded, incorporating insights from various psychological theories and research. This therapy emphasizes the exploration of unconscious processes and the understanding of how past experiences, particularly in early childhood, shape present behavior and emotions. Historical background. Sigmund Freud and the birth of psychoanalysis. Sigmund Freud, an Austrian neurologist, is the founding figure of psychoanalysis, the precursor to modern psychodynamic therapy. Freud's work in the late 1800s and early 1900s laid the groundwork for understanding the unconscious mind. He introduced key concepts such as the ID, ego, and superego, which represent different aspects of the human psyche. The ID is the primitive part driven by basic urges and desires, the ego is the rational part that deals with reality, and the superego is the moral conscience. Freud's method of free association, where patients are encouraged to speak freely about whatever comes to mind, was revolutionary. It aimed to uncover repressed thoughts and feelings, believing that bringing these to conscious awareness could relieve psychological distress. His work on dream analysis, defense mechanisms, and psychosexual stages of development has been instrumental in the development of psychodynamic theory. Post-Freudian developments. After Freud, several theorists expanded and modified his ideas. Carl Jung, Alfred Adler, and Erik Erikson are notable figures who contributed significantly to psychodynamic theory. 1. Carl Jung. Jung introduced the concept of the collective unconscious in archetypes. He believed that beyond the personal unconscious, there is a deeper layer shared by all humans, containing universal symbols and themes. 2. Alfred Adler. Adler emphasized the importance of social factors and introduced the concept of the inferiority complex. He believed that individuals are motivated by a striving for superiority and that feelings of inferiority drive behavior. 3. Erik Erikson. Erikson expanded on Freud's stages of development, proposing 8 stages of psychosocial development, each characterized by a specific conflict that must be resolved for healthy psychological development. Theoretical foundations. The unconscious mind. The concept of the unconscious mind is central to psychodynamic therapy. It posits that much of human behavior is influenced by thoughts, feelings, and memories outside of conscious awareness. These unconscious processes can manifest in dreams, slips of the tongue, Freudian slips, and symbolic actions. Psychodynamic therapy aims to make the unconscious conscious, helping individuals understand the underlying motives and conflicts driving their behavior. Defense mechanisms. Defense mechanisms are unconscious strategies used by the ego to manage anxiety and protect the individual from emotional distress. Freud and his daughter, Anna Freud, described several defense mechanisms, including 1. Repression, burying distressing thoughts and feelings in the unconscious. 2. Denial, refusing to acknowledge reality or facts. 3. Projection, attributing one's own unacceptable thoughts or feelings to others. 4. Rationalization, justifying behaviors or feelings with logical reasons, avoiding the true explanation. 5. Displacement, redirecting emotions from a threatening object to a safer one. Understanding and identifying these mechanisms in therapy can help individuals gain insight into their behavior and emotional responses. Object relations theory. Object relations theory, developed by Melanie Klein, Donald Winnicott, and others, focuses on the importance of early relationships, particularly the bond between the child and primary caregiver. This theory suggests that early interactions shape the way individuals perceive and relate to others throughout life. Internalized representations of these relationships, known as internal objects, influence how people experience and respond to relationships in the present. Attachment theory. Attachment theory, developed by John Bowlby and Mary Ainsworth, emphasizes the importance of early bonding experiences between infants and their caregivers. Secure attachment, characterized by consistent and responsive caregiving, leads to healthy emotional development and the ability to form stable relationships. Insecure attachment, resulting from inconsistent or neglectful caregiving, can lead to difficulties in relationships and emotional regulation. Psychodynamic therapy often explores these early attachment experiences to understand current relational patterns. Techniques and methods. Free association. Free association is a cornerstone technique in psychodynamic therapy. Patients are encouraged to verbalize their thoughts without censorship or filtering. This process allows unconscious material to surface, providing insight into underlying conflicts and issues. The therapist listens attentively, noting recurring themes, contradictions, and significant emotional reactions. Dream analysis. Dream analysis is another key technique, based on the belief that dreams are a window into the unconscious mind. Freud described dreams as the royal road to the unconscious, containing symbolic representations of repressed desires and conflicts. In therapy, patients are encouraged to recall and discuss their dreams. The therapist helps interpret the latent content, hidden meaning, behind the manifest content, the actual storyline, of the dream. Transference and countertransference. Transference refers to the phenomenon where patients project feelings and attitudes from past relationships onto the therapist. This can provide valuable insight into unresolved conflicts and relational patterns. The therapist's role is to recognize and analyze these projections, helping the patient understand their origins and implications. Countertransference, on the other hand, occurs when the therapist projects their own unconscious feelings onto the patient. Awareness and management of countertransference are crucial for maintaining an effective therapeutic relationship and avoiding personal biases that could interfere with therapy. Interpretation. Interpretation involves the therapist offering insights into the unconscious meaning of the patient's thoughts, feelings, and behaviors. This process helps the patient gain a deeper understanding of their internal world and the root causes of their distress. Effective interpretation requires timing, sensitivity, and a thorough understanding of the patient's psychodynamic history. Applications of psychodynamic therapy. Depression and anxiety. Psychodynamic therapy has been shown to be effective in treating depression and anxiety. By exploring unconscious conflicts, early attachment experiences, and maladaptive defense mechanisms, patients can gain insight into the root causes of their symptoms. This understanding can lead to symptom relief and improved emotional regulation. Personality disorders. Psychodynamic therapy is particularly well-suited for treating personality disorders, such as borderline and narcissistic personality disorders. These conditions often stem from early relational trauma and maladaptive patterns of relating to others. Through the therapeutic relationship, patients can explore these patterns, develop healthier ways of relating, and build a more stable sense of self. Trauma and post-traumatic stress disorder, PTSD. Psychodynamic therapy can also be beneficial for individuals who have experienced trauma. By addressing the unconscious impact of traumatic experiences, patients can process and integrate these experiences, reducing symptoms of PTSD and improving overall functioning. Techniques such as free association and dream analysis can help access and work through repressed traumatic memories. Criticisms and limitations. Length and cost of treatment. One of the primary criticisms of psychodynamic therapy is its length and cost. Traditional psychoanalysis can take years, with multiple sessions per week, making it inaccessible for many individuals. However, newer forms of psychodynamic therapy, such as brief psychodynamic therapy, have been developed to address this issue, offering more focused and time-limited treatment options. Lack of empirical evidence. Another criticism is the perceived lack of empirical evidence supporting psychodynamic therapy compared to other approaches like cognitive behavioral therapy, CBT. While there is growing research evidence supporting the efficacy of psychodynamic therapy, it historically lagged behind more structured and easily measurable treatments. Critics argue that the subjective nature of psychodynamic concepts and the difficulty in operationalizing and measuring unconscious processes contribute to this gap. Resistance to integration. Psychodynamic therapy has also faced criticism for its resistance to integrating findings from other psychological approaches and research. While there has been some movement towards integration in recent years, traditional psychodynamic therapists have been slow to incorporate cognitive and behavioral techniques that could enhance treatment effectiveness. Modern adaptations and integrations. Brief psychodynamic therapy. Brief psychodynamic therapy is a time-limited approach that focuses on specific issues and goals. It retains the core principles of traditional psychodynamic therapy, such as exploring unconscious processes and early experiences, but is more focused and structured. This approach typically involves fewer sessions, making it more accessible and cost-effective. Integrative approaches. Many contemporary therapists use an integrative approach, combining psychodynamic principles with techniques from other therapeutic modalities. This can include incorporating cognitive behavioral techniques to address specific symptoms while using psychodynamic exploration to understand underlying issues. This integration allows for a more comprehensive and flexible approach to treatment. Relational psychotherapy. Relational psychotherapy is a modern adaptation that emphasizes the importance of the therapeutic relationship as a central component of the healing process. This approach views the relationship between therapist and patient as a dynamic, interactive process that can reveal and transform relational patterns. It integrates insights from psychodynamic theory, attachment theory, and contemporary research on interpersonal relationships. Conclusion. Psychodynamic therapy, with its rich historical roots and evolving theoretical foundations, offers a profound and comprehensive approach to understanding and treating psychological distress. By exploring unconscious processes, early relational experiences, and defense mechanisms, it provides deep insights into the human psyche. While facing criticisms and challenges, psychodynamic therapy continues to adapt and integrate new findings, maintaining its relevance and efficacy in the field of psychotherapy. Through techniques like free association, dream analysis, and the exploration of transference and countertransference, psychodynamic therapy helps individuals gain a deeper understanding of themselves and achieve meaningful psychological change. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.